So as a neurologist, I often get asked, why did I go into this very subspecialized topic of trying to figure out how we can manage epilepsy during pregnancy to keep seizures controlled and also have healthy baby outcomes. And it was a while ago that I trained, but just to kind of explain why I went into this. When I trained, it was really atrocious. How women with epilepsy were counseled, how girls were, how adolescent teenage girls were. And they were told, well, we don't know, we think it's too risky, so you just shouldn't have children. Or if you do get pregnant, then you should stop all your medications. And I realized, even though that was clearly wrong on the part of the physicians, neurologists, a lot of it was out of fear. And it was fear because we didn't have the information to be able to manage women with epilepsy during pregnancy safely. And so the easiest thing to do was to give an answer that was just a blanket black and white statement. And I realized, well, if we get the information, then we will be able to encourage women with epilepsy to have families, if that's what they want, to go ahead and have pregnancies, and we can reassure that they will have healthy outcomes. But we need to get the data and we need to get the research. And so over that period of time, several of us really started working in this field, and we across the world, across the globe, and we've gotten so much more information from pregnancy registries across all the continents, and also here in North America, that have given us information that lets us know that there's no reason to lump all the seizure medications together, that they're all different. And yes, there are ones that are very high risk, which is valproate or valproic acid, but we have medications now we have enough information on that we know are very, very low risk, if little to no risk, for increasing the risk of birth defects. We've also gathered information about how do those children do long term. How do their babies learn afterwards? Are there any effects on the brain? And those are a few pivotal studies, but among them is NEED, neurodevelopmental effects of anti-epileptic drugs, and MONEED, maternal outcomes and neurodevelopmental effects of anti-epileptic drugs. And then we've also learned how to manage the medications for seizures so that we can keep the seizures controlled, and how the body changes during that time, and how we can maintain seizure control with keeping level steady. We've also done work to show the safety of breastfeeding and encourage our women to still breastfeed despite the fact that they're on medication. There's no ill effects of the breastfeeding on the medications. And so I think we're in such a better place. We have so much work still to do. And the only way we have this information is because people like you that have volunteered to participate in these observational research studies to give us the information so that you have choices as you're entering this phase of your life and on your journey,